Hey Angie, so here is the game plan for that ankle of yours. I think the number one thing is going to be pain avoidance, and I think you had done a decent job of that over the last few weeks, but I think we can do a little bit better. Again, we want to get the amount of times that you feel pain, discomfort, ouch in that ankle to be really the first goal. We just got to get single digits, right? And because right now it's hurting you dozens and dozens of times throughout the day, even with the right shoes and support. So we got to get that number way down. Stairs obviously is going to be a big one to adjust. The amount of walking, just taking rest when you can, avoiding those lunge positions, those twists and turns. I know life happens and you're going to get a few of those, but anything that we can easily reduce anytime we can easily reduce the frequency of that, the better. So let's really work on that, number one. Number two is going to be the inflammation. You had tinkered with it before, but now we need to go all in. So I want you icing 3 times a day. 5-minute session is plenty. Just get it cool. But let's go at least 3 times there. If you can get 1 at work, beautiful. If not, after work, before dinner, before bed, kind of routine would be fine. I want ibuprofen with those around the clock. That seems to be your best choice so far. And then we're going to keep that tape on around the clock and keep the most supportive shoes on you can around the clock. We really just want rest and recovery and just let this tendon chill out because it is pretty darn inflamed at the moment. From a physical standpoint, again, there's not a lot of physicality to happen yet. In a week or two, we're talking, stairs and lunging and strength work and band work and all that. Nothing yet. I don't think that tendon can handle any of that yet. So the 2 that I want you to start with, again, I like this cross leg position because you can do it anywhere, and the resistance is built in. Either the resistance is coming from your hand as you push up, or the resistance is just coming from gravity as you pull up to the ceiling. Again, remember, don't go from the toes. That's not the muscle we're worried about. Try to push from the heel. That is more of the mechanism that we're trying to strengthen there. So first one is going to be just match your own pressure, hand on the heel, push into your hand, but no movement or very little movement. Just hold for about 5 seconds. 4, 3, 2, relax, and repeat. 5, 4, 3, 2, 1, relax. Maybe 10 of those, plenty. That's all we need. We're just trying to use the muscle as aggressively as we can with no pain associated. Once you can do that pain-free for 10, no problem, and it's feeling pretty good, then we go to active motion. Roll your ankle to the ceiling. Roll your ankle to the ceiling. Today that was tender. I'm hoping in a few days or a week, that's no problem. Once that's no problem for 10, 15, 20 reps, then we can start talking about bands and body weight work and all that. But that's it for now. Against your hand, and then graduating to against gravity. A couple times a day, 3 times a day maybe, just kind of mirror that with the ice. That's all we need. Not specific to that tendon, but other things are getting mad, right? That left calf gets mad. I'd go ahead and throw on a little bit of a calf stretch, especially for that left side. Couldn't hurt you to do both. I think occasionally doing some heel raise, toe raise, just kind of good ankle mechanics right now. We're not trying to beat it up with a workout, but just to show, hey, it's okay to use all the rest of the ankle as normal, and really should. Just make sure you're pain-free again with any of those. And if any of those hurt, even I think we're gonna get some 1 out of 10 pain here and there. I'm trying to, let's make a 2 out of 10 our max. Yeah, I just don't want it to get like a 7 or anything like it was in here today. Again, wear the tape pretty consistently. I'll send you a link. We can always add to that. The only thing I would do there is maybe, when you are going to change the tape or when it starts to fall off, go a night without it. That way the skin can kind of chill out and breathe, and then tape it again in the morning. Just 12 hours without would be nice for just skin health down there. And then, the big thing is just, again, wear the right shoes. I think, you figure that out. But again, no excuses here, at least for this first week. Once we get past this first week and it's not as tender to touch and you can move freely, range without pain, then we can treat this thing a little more like a normal injury. But right now it's a very angry injury. So reach out if you have any questions. Otherwise, look forward to seeing you in a week or two, and we will keep on trucking. All right, thanks a lot. Bye.